responsibility.
Well, that's what I
Are you
mean.
able to do that, and how would you do it?
Well, the first thing I would do is publish the data of where it went, right? Like, you know.
Where would you publish it, in the newspapers?
Oh, on the city's website itself. So then the press has access to it, but the people have access to it, and the authorities,
Yes.
right? Because you don't have to go to the newspaper to publish. You could publish it right on the city's website.
Right, and then what?
So then, first of all, that's for the past, right? But for the future.
No, it's not for the past. She has to be accountable for that money. I don't think there's
Oh
a
no,
grace
but
period.
oh no, I'm not talking about grace period. I'm talking about we want to go after the money for what has already happened, but you don't want
Absolutely.
anything like that happening again,
Well, why
right?
should it have happened in the first place?
Yeah.
That needs an investigation.
I agree.
That's why we need
Are you
Republicans
able
in
to
our
do
city
that?
government,
Well,
one party.
public advocate wouldn't be the investigator, right? So we need to have, like, whether it's attorney general or district attorney.
Then where do you go to contact those people that are responsible for the investigation?
So those are other elected officials, right? But they can't do anything unless the.
Promoting it for those very important
Well,
positions.
yeah, so Tom Kniff is running for Manhattan District Attorney, but I think there are other people running for New York Attorney General. I mean, it kind of depends how the money was spent, but right now we can't even figure out how the money was spent.
It was stolen.
Yeah, exactly, right?
Well, why don't we get real?
Yeah, exactly. So the first step would be to know what happened to the money, right?
Yeah,
Yeah,
absolutely.
so that's something the public advocate can do.
Uh-huh.
Yeah.
Go for it.
Yeah, exactly. So that's all I'm saying. So I can't do step one through like the investigation, the prosecution, but I can at least make the data out, available and transparent, which a lot of people could have done but chose not to do.
I wonder
right?
why.
Yeah, exactly. So I would say that's the first thing. Public
Right.
advocate. Right now they're kind of looking at it like as though only the mayor, the mayor's wife, or maybe the comptroller
Are you
could have.
able to get in touch with Jemani and ask him why he wasn't on top of that?
Well, that would be for the debate.
Yeah.
We need her to get to the
That's why I'm
debate.
trying to get to the debate.
Get her to
Yeah.
the debate, guys, please.
Yeah.
Uh-huh.
Promote.
Yeah.
We need support, because this city is a one-party system here.
Yeah.
The media is in bed with the Democrat Party.
Right.
We need to force this debate because the media don't want this debate.
So then how can we help you to?
Donate, whatever you
Yeah.
could, $10
Is
or
that
more.
always the solution to donate?
Apparently, yes, in this case, yes, because
By
you were just
law.
mentioning about
Yeah.
how's Curtis Lewa, how come we don't hear about it? No money,
Yeah, right, that's what I told you.
no money, no one hears nothing. The media's covering Curtis Lewa when he does his little press conferences? No.
Yeah, I mean, I've done press conferences with him too. They just don't cover them. That's the thing.
Right.
Yeah.
We have one question in the back.
Thank you.
Oh, yeah.
Do we have, oh, you just,
Well,
Sure.
it's not really a question, it's more of a comment in response
Yeah.
to that. Each agency has something called an open records portal, which allows them to publish data that anybody can go and look at.
Yeah.
And I think the public advocate's office can do something similar.
Yeah, the public advocate can. The public advocate also has access to every city agency's data. So that's how they can organize it and kind of put it on. Because one thing that some of these agencies have done that I noticed is they publish stuff, but they publish it in like a not usable format. So the thing is, they can technically say it's out there and it's public, but it's not something that anybody can really like. It's just sort of like. It's not, it's too burdensome to try to go through all of this and try to figure out what it means, right? Like, you need the data to be something that's clear and understandable and somewhat user-friendly, right? Otherwise, it's sort of like a data dump, like all this stuff that nobody can figure out understanding, right? Like, it's gotta be something that makes sense. Like, if I were to try to figure out how is money in my family, like, being spent, like, what's our budget, you can't have, like, things be, like, 3,000 pages. You want to see some kind of pie chart, like, this is what we spent our money on, and then within each thing, like, oh, okay, this is what we did. So, like, we can figure out exactly where did the money go, if we want to save money, or if we spent too much here. It's got to be usable, yeah. And why can't the city, I understand we're big, but we should have some kind of organized sort of format of what we're doing. I mean, even homeless people, I was going to say, even homeless people have approached me on the street and said they'll support me because, they are upset about the money and the way that it's been spent, because they've seen me walking to work throughout the pandemic to treat the patients. They don't know all the details, but they have said, like, they've seen me walking to work back and forth from the subway throughout this time. And so that the way they put it is that money was supposed to be for us. That money was supposed to be to help us. And where is it? You know, it's gone. So they look at it like they were cheated out of money that was supposed to make their circumstances better. They're being abused, like in homeless shelters. They're afraid. I treat homeless people too as patients, and they tell me, like, you know, they cannot use their canes. They cannot use anything that would normally help them because it's like having a big target on their back for some predator sociopath to attack them, you know? So they're afraid to have their medications because they could get stolen. They're afraid to have anything that might signal that they could be weak or disabled because that's a good way to get assaulted. So they're afraid to be trapped in a place with no police, no security, nobody that could help them, and, you know, and that's their situation, you know. Meanwhile, like, taxpayers have paid a fortune for a program, money's missing and stuff, so where did it all go? The people that could let us know, you know, nobody's really kind of forcing them to answer, right? And it's all, like, disappeared.
Can we have, like, I volunteered when Trump was running and I went to Trump Tower.
Yeah.
I wanted to talk. I didn't think anything about politics. But he had a center where people were able to make phone calls for him, like, hi, you know, and can we do that for you here in, you know, are you going to have, like, a place, like, even at where we can call and give us a list of names?
Oh, that would be awesome. I mean, we have lists. So that we have. I have to talk to Ted Gora more. I was talking to him because what it is we have our campaign office in Manhattan, but everything, so again, like, some of this, I wonder, like, people talk about, like, in Georgia, the voter suppression, but I wonder about the candidate suppression, honestly, like, in New York, because, so the campaign finance laws are that if I have any space, we have to pay rent for the space as well.
Right.
But then if I was going to raise the money, like, part of me wonders, should I spend it on rent, or shouldn't we spend it on the things that are most high yield in terms of reaching, like, all the other, you know, the other voters, because the rent in New York City is expensive, right? So
we can do a place here in Brooklyn. It wouldn't be that
as
expensive.
expensive, yeah.
And it still can reach out to Manhattan too.
Yeah,
and
yeah.
everywhere. So if we can have a center where people can call up, have a script.
Oh yeah.
And we can
Well, I
call
think what
up.
they were
I
doing
don't know how to do
also
that.
with
What?
the Trump campaign, they were giving you
I did it.
lists that you
Yeah,
could
I
do
did
it
it.
from home.
Yeah, I did
There might
that.
be a way where you could get lists
Yeah.
and so they vet you first. I want to make sure you're not.
And you write a monologue for people to,
Yeah,
you know.
and you can
I
do it
did
from
that. Hi. And then you go from no, I mean Trump.
Yeah.
I know it was fun.
Oh yeah.
So if we can have a center in
Oh, yeah.
Brooklyn, it's cheaper, where people can just go in there and
Do
put
it.
in your time.
Yeah.
No, call it
Yeah,
volunteer.
so she was mentioning Ted Gora. Ted Gora is the Republican chairman of Brooklyn, Kings
Right.
County. So hopefully they're going to be doing some phone banking also for
Well, we can
the.
work with her and go
Yeah.
there.
Yeah.
So we
We
hopefully
can
could
find
do
a
that.
space.
Yeah, because I think because he's the chair of the Republican Party here, they might be able to use their space
Well,
without
they
us
have to.
having to pay, you know, because it's already Republican space.
Okay,
you
so
know?
then
Yeah.
let them help you put up a space
Yeah.
where people can come in and sit down,
Yeah.
have a monologue, call up, and
Yeah,
you know,
once
have a
once
list
that
of
happens,
everybody.
we will let you know through the email. That's why I said, for those of you who didn't sign in yet, Larry will be sending it around. So please sign in, put your email address on there, so that way when we have events or when important information, like you want to help phone bank for the doctor here,
I appreciate the
we need
offer
your
to do
email.
it.
We can't just, you know.
I'm impressed.
Oh, thank you,
No,
thank you.
but
yeah.
if you can get in touch with him to help him,
Yeah.
just tell him what you're gonna do.
Yeah.
Don't have, just say, this is how we have to run the campaign.
Yeah, of course, yeah.
And, you know, that's it.
Yeah.
Everybody now knows how Governor Cuomo
Yeah.
lied about how many deaths there were in the nursing homes
Yeah.
that he had a hand in causing. And my question to you is, you know some people have very negative side effects from the vaccines.
Yeah.
Do you think that that glorious mayor and the city government and the state government are covering up the number of people who have negative side effects from the vaccination?
I don't think they even reporting.
Yeah,
No.
that's what I would
There's
say.
no
So
covering
Ms.
up.
Glenn, they're
There's
not
no
reporting it.
statistic to
Yeah.
even show that they're not doing it. in the hospitals, and no one's saying,
Yeah,
"Oh, this is
doctors aren't even
you have a heart attack." Well, maybe because you're fat.
The VAERS
You're gonna have a heart
reporting
attack.
system shows over 13,000 deaths already.
Yeah.
So
Yeah,
and
yeah, yeah.
they're saying
right.
it's
There's at least
underreported.
13,000
I know
deaths.
3
Already
people on the
reported.
50 that
Over
died in the
500,000
past 3 months. They were all
reactions.
vaccinated, and that's more people I know in the last 3 years that have
Yeah.
died. And
Right.
stuff. So,
And also, you know, this is only people that actually
Oh,
figured out
that's
how to
not
report
vaccinated.
things. I feel like, you know, what about the people, it's like, you're getting vaccinated in the not the usual route. Like, usually it's with primary care, pediatricians, and everything else. So it's like, there's nobody, these are, the people that you might tell are not people who are used to any of these things, right? Like, they're not used to the usual protocols and stuff. So when the vaccine first came out, I'll say, like, when it first came out, my office volunteered to participate in the vaccination process, right? Because it's supposed to be life-saving. It came out. So it took a week to be able to volunteer because the process was so tedious. Like, they had the same number for patients to sign up as for healthcare providers to be able to volunteer. So 3 offices, like, it's a private practice, so, you know, it's within this building in Manhattan. 3 medical offices tried to volunteer. We all had to go through the same process, and we all got turned away. So I perform like nerve blocks, spinal injections, all kinds of stuff. This is like delicate stuff, like next to the spinal cord and the brain. And then they said, like, no, we don't think you can perform the vaccine injections. Literally, that's what the letter back to us said. Like, we prefer to have people that are used to doing this, like, not you. So, I mean, I'm paraphrasing, but that's what it said. So I remember thinking, like, are they crazy? Like, we are doing things that could paralyze and kill people, but they think it's not safe for me to do a vaccine injection. So then I was like, this is insane. Like, this is so tedious. Like, I've paid my staff and everybody to spend time on this website and the phones just to be able to volunteer. Even if you want people to volunteer in any kind of crisis, like, you shouldn't put them through this, you know, to try to get through to you, to offer to help you, you know. But then everybody in the building said they had the same process, and these are surgeons and people who perform orthopedic surgery, people who do, like, you know, deal with, like, life and death situations, but they all receive the same thing, turning them away. It's not like, so then I thought, this is so bizarre. But then I wanted to see, like, well, who are they having doing the vaccine? Because I thought must be somebody who's, like, prepared to deal with anything. Like, but then I saw Governor Cuomo give, like, a press conference that he did the vaccine. Somebody, remember he did that weird press conference where he said, you don't know where I injected them, and I okay, what?
He gave a vaccine.
Yeah, he gave a vaccine to somebody, but it was a weird press conference. Do you guys see it?
No, I
He
never
made
did.
a joke. Well, he made a weird joke because he was like, you guys don't know where I injected the person, but it was kind of a weird joke, like.
Well, that's why he's in this trouble.
Do you, in your practice, have the ivermectin and the hydroxychloroquine? Do you distribute that for patients that come in?
No, so I can't because since I do these spine procedures, like, they, first of all, like, they wouldn't allow any doctors in the beginning to do it. So even patients who had lupus, where hydroxychloroquine is used for that,
Right.
I see patients who have lupus. I'm not the one primarily treating them, but because they have pain, they come to me. They said they couldn't even get the medication from their regular doctors who prescribe it. But New York was so tough, like, in terms of getting the medication. But then on top of that, because I'm not a person who normally prescribes it, like, they just won't allow you to prescribe this stuff. So I can't. But yeah.
Question
But sorry. Good.
What about setting up, like, in Florida?
Yeah.
Ron DeSantis set up those clinics to get I don't know what it's called. I'm not very good. You know, they can set up these clinics where people who come down with the virus, if they have the vaccine, they can go there and help cure or get rid of the virus. You know what I'm talking about?
Talk about the pods, like the point of dispensaries.
Yeah. In Florida, he set up these free clinics. Like, if you have virus, and you can go down.
I'm sure you can assert to this city health department. Ones they call them pods, PODs, like point of dispensaries.
Yeah.
They're currently running,
Yeah.
But non-medical folks can, like EMS can volunteer for those.
Yeah,
So
that's
to
not-
reinforce what you said earlier.
Yeah.
Yeah.
I think also, just getting back to the original point and then kind of putting these together, with the side effects from the vaccine, like the problem that I have with this situation is that if you have people who are not used to any of these things, how do they know how to report a problem? So they're not used to assessing if someone's having a problem, right? So if the person who's getting the vaccine, forget about COVID, let's just talk about any vaccine or any procedure or any medication or anything, right? Someone is having a problem, they may or may not realize they have a problem. That's why even for regular things we do a consent, because we have to warn them what the side effects are. Even if you go pick up a medication at the pharmacy, like the pharmacy will give you, a page or two of all the side effects so that you have some idea of what could be a possible problem, right? You have to have some idea of what you're looking for to know if you're having a problem. Then, it has to trigger your attention as the person who's receiving the treatment or whatever it is. Then you have to go to this other person and convince them that maybe you're having a problem. Then it has to kind of trigger something in them that they would either treat you and report it, right? So then they have to know what the process is to report it to that database. Otherwise, it's not going to get entered in any database. So there's all these steps that have to be followed before something's even reported. And then if you have 13,000 deaths, well, what about all the other things that might happen that, nobody's heard of or whatever else? That's the thing. So things have to be looked at more. I was specifically thinking about all the kids with the myocarditis and pericarditis. The reason is because I myself, it's ironic, but the reason I became a doctor is because I myself had pericarditis as a kid. I had constrictive pericarditis, pericardial tamponade, which is where there's fluid around the heart. It crushed my heart. And when I was 16, I had a cardiac arrest, which is where, you have a code blue, and I was in this abnormal rhythm called BTAC. So it happened in the hospital because I was not feeling right, and basically I had this cardiac arrest because I was in the hospital. They resuscitated me. I was in the ICU, and exactly, so there was no pulse. That's why, this all happened. So I was in the ICU on and off for 30 days. I was on a ventilator, I couldn't return to school full time for 8 months. And my parents kind of thought I might be disabled from the whole thing because I had all these problems, heart and lung failure. So my dad quit his job. The reason he quit his job is because my mom had better health insurance. She worked for the city of New York. So it had to be that she had to keep her health insurance. He left his job because he was planning to kind of take care of me for life. So there wasn't really all these benefits that we have now. This is early 90s, So basically, that was the plan, but then I got better, and that's how I became a pain physician, because there was no such thing as pediatric pain then. I don't have pain now, and I have recovered. But at that time, you're in the ICU, you have a ton of painful procedures, all kinds of stuff. And as a kid, they really don't give you anything, you just get sliced and diced, so that was the way that went. But then I started thinking about people who have these catastrophic injuries, all kinds of stuff. That's how I started working with the combat veterans. I worked with prisoners of war. I worked with people who've been tortured around the world, like refugees, Cambodians who face the Khmer Rouge, people who've been electrocuted, raped, people all over. I've traveled all over Asia. I've traveled with a red State Department passport, which is different than our blue one, but to teach healthcare workers around the world how to treat some of these people who've been victims of torture. But just getting back to this, you really have to have people who know what they're looking for. Otherwise, all this data we're collecting, it's really not going to show you a full picture of what's going on.
I'm a health freak person, whatever all that. But my daughter and I, don't freak out, because I'm older, poor, and white, and not I felt that I had to take the vaccine to protect myself, because I don't want to go into hospital and they would say, Mrs. Andrioli, you didn't get the vaccine, you're old, poor, and white, so we'll have to get rid of you. And so I have to protect myself, and I'm trying very hard. But it's not a matter, we have to have choices. And I felt that the only way, my daughter and I said, we'll just become zombies together. And I had a feeling the vaccine wasn't, but I just felt freer. Hey, everybody got the Trump vaccine, they keep away from me. But 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 we don't know the facts. Some people say this, and then I'm not a good debater. Some people say that.
Oh yeah.
So the idea is, right now we have to have choices, and they're taking away our choices.
Right, that's the.
Yeah.
That's the most